topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
My favorite city, Dallas-Fort Worth. I spent probably about 30 years in Dallas. My favorite city, even though I live in Florida now, I miss Dallas. And today we've got a fantastic show. I can't wait to introduce you to our expert, Dr. Daniela Gamboa with the Elite Care Clinic. Good afternoon, Dr. Gamboa.
Hi, Steve. How are you? Thanks for having me.
Oh, we love having you. I got to tell you.
Thank you.
I ran a promotion this morning about your show, and I got at least 10 people who just wrote back, which normally doesn't happen. And I can't believe it was not just people in the Dallas-Fort Worth area that listened to your show. We had people in Waco, Temple, of course, we had some in Fort Worth, but they were all new people, read about your show coming on. And so I know we got at least 10 or 11 new listeners today.
Awesome.
But good afternoon. How are you doing? Dr. Gamboa is with us every month. It's real easy to keep up with her show because she's the last Wednesday of each month. She's on at 4 today, but we're going to make it where she's on at 4:25. Last Wednesday of each month. Tell us what is going on at Elite Care Clinic, Dr. Gamboa.
Hi, Steve. Thank you again. Yes, so we are happy to be here. And also, at Elite Care Clinic, we take care of you. It's a wellness clinic, basically. We take care of all your health problems. We help you with the weight loss. And to me, the weight is the main issue from the problem. So if we take care of that, then we will help you with decreasing your blood pressure, improving your diabetes, or even having the diabetes be on remission, and then also improving your quality of life, Also, we do hormone replacement. That's all with the weight loss, and it's all with the wellness, and so that you can be having a great quality of life whenever we get older.
Do you actually measure people's hormones when you decide how you're going to treat them?
Yes, I definitely also I take in account all the patient's symptoms. And, if we are in the perimenopausal age, in the between 45, 48, and later on in menopause after 52 years of age, for sure, we're going to have a lot of hormonal derangements. But honestly, our hormones start trickling down whenever we're 30. So at our 30s, our hormones, especially our testosterone, starts going downhill, and it gets worse and worse. And it can be the cause for all our symptoms. And sometimes we may think, it's only anxiety or depression. And that usually happens during the perimenopausal age or time. But it could be only your hormones. And whenever we help you and we balance your hormones, you feel great, and you feel like you were in your mid-20s or 30s, and you feel awesome.
A lot of people are listening now on iHeartRadio to the show, though we do have TV. I got to tell you something. You heard the expression, practice what you preach. Well, let me tell you something about Dr. Gamboa. She looks like she's 20 years old. She's got all this energy.
Thank you.
But you look so good, Dr. Gamboa. And,
thank you.
I'm so glad to have you. I had a few people women ask me, What is the best way for women to lose weight?
This is a very interesting question because, like, women, we are more complicated as with everything. And, like, so we need help with many things. Because, let's say, and I think I mentioned this before to you, if we have a husband and wife join my weight loss program, the wife is always angry and like upset because she only lost 3, maybe 5 pounds, and the husband lost 15. So, like, so that always happens. But it's because we have the hormones that play a big role with us. I mean, testosterone plays a huge deal also with men. Like, it helps decreasing the visceral fat. It helps with the decreasing the insulin resistance. So it helps a lot, and also making more muscle. The more muscle we need more cells, more mitochondria. Those are the ones that they make the energy for the cells. So obviously we're going to start burning more fat. So that's why guys are a little bit easier to lose weight. But also in women, we have to take in account the thyroid. Thyroid plays a huge role also in our weight, And as we get older, or if we are having like a very heavy period, our iron levels go down. So then that causes our thyroid not to be working properly. So the thyroid is the director of the orchestra. It's going to determine our basal metabolic rate. So then that goes down. So then we are burning less calories. So for women, it's always, why am I gaining weight if I'm eating almost the same things, but
Right.
we're burning the same, So that makes a more trickier thing. So for women, we have to attack it for different angles: hormones, thyroid. We have to check your iron. We have to check many other things to help you starting to lose weight.
We just got a text in, a lady listening to the show. She's from Grapevine. That's close to you.
Oh, yes, that's right here.
I just found your show. What is your thoughts on topical estrogen for women?
Like topical estrogen, like if it's a bioidentical, most likely is because it's compounded. It's great, like how we can replace our hormones, but also make sure that if you're using the estrogen, you also have to have progesterone by mouth, because the thing is that think like this: the estrogen is the gas pedal and your progesterone is the brakes. So like the estrogen makes proliferation. So whenever you're taking or using estrogen, no matter like the one that it's on the topical one, that's usually systemic, then you definitely need progesterone as well. No matter if you don't have a womb anymore, your uterus is gone, you still need progesterone to protect your breast tissue. So always make sure that you do that.
Well, they should not just go to a store and buy. I want to make this show where people should come in, sit down with you, because not everybody's body is the same.
Exactly.
And you have a lot of tools in your bag
To help you.
which
Yes.
you can help people with. I got to throw something in. I don't want to scare you at all, but my brother-in-law, who's head of internal medicine at Baylor Hospital,
Oh, wow.
is watching today. I've had my show for 12 years, and this is the first time. So we got a big wig listening today.
That's awesome, because also, I belong to Baylor, but I'm a community physician, so I don't have the admitting privileges, but I am credentialed with them so that it's as a community physician. So that's good.
Yes, absolutely. So I've got so many questions for you today. When somebody calls your office and they want to sit down to talk to you about not training them, but teaching them, and like I said, we talk about everybody's different. How do you start off? Is it different from male versus female? What kind of question do you do? A history and physical on them first? How do you do it?
Oh, yes, for sure. So basically, like whenever they call and they want to be, let's say, interested in weight loss only. So for sure, I need recent labs. At least I need like less than 6 months old. And many
Okay.
patients, they just think that this is a weight loss program. They come and I start them right away in the medications. But no, I have to make sure that their thyroid, their sugar, their cholesterol, everything is doing well, their kidneys, before I decide which medication is going to be the best for them. And also, once I decide like which medication is the best, we also have to see what your insurance is going to cover for you, or if you can afford it if your insurance doesn't cover it.
You know what really gets me, Dr. Gamboa, is there's so many things that you do that would help people's health out, which why would an insurance company not cover it when you could be saving them a lot of money in the long run?
I agree with you, Steve, and I wish the insurance companies are listening, because what happens is that the problem with insurance companies that I see is that I don't see that they believe in the prevention part, or
Yeah.
maybe they just want to save money right now, but they don't see how much they're going to save the life of this patient and the money in the long run. Because, for example, if I am able to help lose weight for this morbidly obese patient or class 3 obesity patient, then this patient is not going to need the BiPAP, the CPAP, is not going to need maybe a stent or even a bypass surgery in the long run. He may not need a gastric bypass surgery, which is great in the right setting, but not everyone needs a gastric bypass, but it's all going to help the patients. And this patient also may not develop the diabetes or the hypertension, the high cholesterol, all that. But unfortunately, insurances don't see it this way, and they just see what they can save right now, and they don't see the benefits from this in the long run.
Oh, they could be saving so much money. I've got to ask you, how do you feel about pellets? I've heard so many good things about the pellet.
Oh yes, pellets are my favorite way of replacing hormones, especially bioidentical ones, because the pellets are the ones that are going to give you the levels that are more consistent. They're much better than the injections, or probably the topical ones. Topical are great also, but we also have to the right place where to apply the creams in order to be better absorbed and better levels. But pellets are great, and many things that people don't know and don't understand is that the pellets have been around since the 1930s. Unfortunately, they were not as what do you call it?
Were they
popular.
as strong back then?
They
Were they
like
as strong back then?
Yeah, they were a little stronger because again, they didn't really know about much the levels, and at that time they were not the technology for the checking the hormones that we have now. I mean, the precise hormones. But even now, those levels, they just guide us. But we mostly, we don't work as we're not treating a lab or a number. We are treating the person, and the person is many times, let's say, to give an example, you may need 2,000 milligrams of testosterone versus another one may need only 1,500. But it all depends on your receptors. It all depends on how you do. I mean, the levels are okay, but to guide us at the beginning. But later on, it's mostly how the patient feels and how they like it, how they feel, what energy, all this kind of things.
Pellet now goes under the skin.
Yes, that's
Does
correct.
It hurt? Does it hurt?
Well, it hurts a little bit, and it's not just the skin, it's in the subcutaneous tissue. So we put it in the females in the butt area, and in the guys, there's one technique that they put it also in the butt area, but there's another that better technique that it's more in the love handle, and that seems to be better tolerated, less complications, less extrusion rates. So that seems to work much better for the guys, because that's where they have a little bit more subcutaneous tissue than in the butt area. So that's where we do. And of course, we're going to numb the area with local anesthesia, and then we're going to a special tool. We're going to introduce the pellets in the subcutaneous tissue.
How long do they last?
It depends, but like normally, like in females, it lasts every 3 months. But of course, if like you're having this great energy, you're doing like a lot of exercise, you're going to the gym, or you decide to do a triathlon, then may last only for like 2 or 2.5 like months. The same goes for the guys, but the guys, it's more every 6 months or five
Okay.
months or 4.5. It all depends on your stress level, on your activity, because your heart, depending on how much your heart is pumping, depending on the vasodilation, that's how our body uses the pellets, the hormones.
Um, your last show, I got a lot of mail that I know there's a lot of people out right now who want the answer to this. So we're hearing in the news about injections that were actually made for diabetics that's causing people to lose a lot of weight. Do you
Yes.
know much about it? There's like 3 or 4. There's another one that's getting ready to come out that you don't even have to be a diabetic.
Yes.
What do you think of this injection?
Oh, like those are great medications, and yes, they started for the diabetics, and we saw that they were great for weight loss because the way they work internally, they regulate your insulin production from the pancreas. They help you at the level of the liver and many other organs, but they are doing great with suppressing your appetite, the hunger hormone, increasing your satiety. So that's how they work, and they help you. Because remember what we mentioned, like I guess in the very first shows, that how your body reacts whenever you lose weight. Your body reacts by by saying, hey, what's going on? Give me back my fatty tissue, my deposits. Unfortunately, your body betrays you. And it tries to increase your hunger hormone, decrease your satiety, decrease your metabolic rate in order for you to regain what you lost. So that's why like obesity is so complicated. It's a chronic disease and we need help. So this injections, that's why they're so famous now and everyone wants to get their hands on, because they really work.
Yes, I
And
heard that.
obviously it has also some like adverse effects, but for the most part they are well tolerated. And if you are doing it under a medical guidance, then they should be great and not have a lot of adverse effects like nausea, severe nausea, constipation. Obviously we try to like counteract those adverse effects, but for the most part they work great. And yes,
I
nowadays
understand
they
you
are.
have to chew your I understand you have to chew your food a certain way when you go on these. And the people who've gotten sick and nauseated are people who did not digest their food right, even after they were taught how to do their chewing different.
More than
It's
that,
chewing
Steve,
more often.
like, yeah, but more than that, I would say like what we need to like um, teach our patients is basically the way they eat, but not just the chewing part. We have to teach them how to eat the portions, the smaller portions, because if before you were able to eat the whole hamburger and fries, now you're going to be able to eat only half of it and maybe not even a fry, And just remember this: these medications are going to slow down your digestion, slow down everything. So if for a person that is not having any of this is not using these medications, the normal digestion time is around what, 4 hours to like empty completely your stomach. Then for these patients it's like 7 hours or more, so that's why we have to make sure that we eat smaller portions and more frequently also, but smaller portions. Because if we just eat once a day and eat the whole thing, oh my gosh, you're going to be sick. You're going to like not being able to tolerate this, because then you're going to try to be nauseated, throwing up, and it's not going to work. Or maybe you're going to have diarrhea from all this load. So it's not going to work out for you. But you have to retrain your brain to eat only whenever you are hungry. And sometimes this is difficult because these medications suppress your appetite. So sometimes you're like, oh, I don't feel hungry, but you have to try to like put an alarm or something, or maybe do one of those protein shakes to help you, because it's not good to be so many hours without eating. And that goes against the weight loss, because then your body is like, oh, this person is starving me to death. Then it goes into hibernation. Then your metabolic rate goes even slower. So sometimes people think, oh, but I'm not eating. Like, why am I gaining weight? That's the reason why. So we have to, too little is bad, too much is bad. So we have to just be like reteaching the patients how to eat properly with this medication.
Dr. Gamboa, God, your show always goes by so fast. Let's give everybody your phone number that they can call your office and make an appointment.
Of course, like it's 469-947-6020, and we are Elite Care Clinic in Las Colinas, Irving, Texas.
Great part is if you've got a friend, doesn't matter where they live, that wants to see the show again, all they have to do is go to iHeart, Ask the Experts Dallas, and you can find Dr. Gamboa. All of her shows are there as well as on YouTube. Dr. Gamboa will be back with us again next month on the Ask the Expert show. Dr. Gamboa, thank you. We love you.
You're welcome. Thank you, Steve.
We're going to go to break. We'll be right back.
And we are back with the Ask the Expert show on W4CY Radio and Talk4 TV with your hosts, Steve-O, Sophia, and their expert guests.
And we are back. Well, this is the Ask the Expert show. We're modulating out of Dallas, the Fort Worth area, and surrounding areas. I love the Dallas-Fort Worth area. It was my home for about 25 years. Missed it a lot. So I really enjoy doing Dallas shows. We have our next guest with us. We get a lot of people writing us, telling us about topics that they want on our show. But personal injury law has always been the number one topic. And it's not easy finding a great personal injury attorney. A lot of people will put up on their shingle personal injury. That doesn't mean they're a great litigator, which you have to be when you are a personal injury attorney. So we feel like we got the best of the best. Let me introduce you to attorney Mark Underwood. Hi, Mark.
Hey, Steve. Thank you.
Oh, man, you so deserve it. How is everything in Dallas?
Everything is good in Dallas. We're not breaking 100 degrees now. We're only 97, 98, so it's practically winter.
I tell you what, the weather in Dallas, for some reason, people always thought it was just hot in Dallas, and they didn't know that we have winters there too. I was in some really bad ice storms in Dallas. So
it always seems like there's about 6 weeks of a real winter. But, after the summer that we've had with, I don't know how many days above 100 degrees, it's good just to be in the 90s.
It is. And you're actually out of McKinney, Texas, where I know the McKinney area very well. Since we're getting all these new people, Mark, would you please introduce yourself? Mark's been with us for a couple of years now. He's with us every month, but go ahead and tell people about your background and about your firm.
So, hey, my name is Mark Underwood. I'm a lawyer in McKinney, Texas. I also have an office in Huntington, West Virginia. When disaster strikes you or your family, we're the lawyers to call. You can call us at 844-UNDERWOOD. That's toll free, 844-UNDERWOOD. Or if you want the numbers, it's 844-863-3796. Again, 844-UNDERWOOD, toll free.
Okay, give us your number again, Mark.
844-UNDERWOOD.
844-UNDERWOOD. Great. And you've been in practice for how long?
Do you want it in human years or dog years?
You must own a dog.
Well, I just feel like I'm as old as a dog sometimes. So I've actually been out of law school for 34 years. 34 years now. So.
Amazing. Mark actually, he's a little humble. He works on very big cases. I mean, we're going to talk, Mark, and I hope you don't mind me doing this today. For some reason, we got a couple, when they saw you were going to be on today, is it okay if we talk about Social Security disability?
Sure. We do a
Good.
lot of Social Security disability. Natalie Hall in our office is a certified Social Security disability rep, and it's one of the areas of practice in practicing law where when people are successful, they come away so happy that you've been able to change their life for the better.
I can see that. Now, do you should have an attorney to get Social Security disability benefits. Explain that to everybody.
So, hey, you don't have to have a lawyer to apply for Social Security disability benefits. And some people can actually win on their own without a lawyer representing them in Social Security disability cases. But the vast majority of people who go through the lawyer do much, much better and much quicker than somebody who doesn't have a lawyer. And, you know, the thing about it is it's a contingency fee, and they just take the money out of your back pay. So it's almost like money that you didn't realize you were going to get is what's used to pay for the fee. And there's a limit on it, according to federal law, that it can be no greater than 25% of the back pay, not to exceed $7,000. Now, hey, if you're a quadriplegic, you've been in a horrible car wreck and you're a quadriplegic, you're probably going to be able to win that without a lawyer. But, you know, if you have severe back pain or you have cancer or a heart condition, those types of conditions, you better get a lawyer to help you get through the process, the maze of Social Security disability.
You know, it's kind of like automobile accident injuries that you handle. I mean, somebody could actually handle if it's not a real bad accident, could handle it. But why not make the playing field level? Have someone represent you. You don't have to write them a check when you go sit down with them. And, you know, an attorney's going to, especially an attorney like Mark, is going to know so much more about the ins and outs than you would.
Well, so, hey, you know, comparing it to a car accident case is kind of interesting because, you know, and actually a car accident case would be easier to represent yourself than Social Security disability. Let me tell you why. So in a car wreck case, you could get your emergency room bills, you could send them to the insurance company, call up the adjuster on the phone, and they'll probably make you an offer. You can either accept or turn down the offer. And they'll send you a release. You sign the release where they ask you to sign it, and they'll send you a check in a small case. Social Security disability, there are dozens and dozens of forms that you have to fill out, and you have to fill them out right. And if you don't fill them out right, your case will be dismissed, your case will be delayed, or you won't get paid. So, you know, in Social Security cases, it's even
because
more.
You're dealing with the government, Mark?
Oh, yes, you're dealing with the government. So,
is it because you're dealing with the government?
That's exactly.
Yeah.
You know, the government has a form for everything.
I bet they do.
Yeah.
So what do you look for an ideal candidate when you're meeting with someone for disability benefits?
Well, the first thing is, you know, there's actually what's called a 5-step process in Social Security disability. And the first step is whether or not they are engaged in what's called substantial gainful activity. And what does that mean? That means, are they currently working? So if a person is currently working, probably not going to get Social Security disability. Now, if they're just working a part-time job just for a few hours a month, they may still be able to get it. And every year, the level for substantial gainful activity changes. But, you know, if you're still working your job, full-time job, you're not going to get Social Security disability. So that's the first thing we look for. The second thing is a combination of impairments and that prevent the person from being able to work. And the next thing we're looking at is how severe that combination of impairments are. And, you know, it might be part physical and it might be part psychological due to the pain from dealing with the physical part. But the next thing we're looking for is whether or not they're capable of doing their prior work. If they're capable of doing their prior work, you're not going to win. And then is there any other occupation that they'll be able to do based upon their age and their disability? So, first step is, are they getting consistent medical treatment? So we'll have the documentation. Second step is whether or not they're still working, whether or not, next step, whether or not they can do past work, or whether or not they can do any other work. And, it's just real important to make sure you're still treating with doctors and psychologists to have the paperwork that Social Security Disability can make a decision on.
Who makes that decision? Is it a judge, a doctor?
Well, it depends on where you are in the process. If on the immediate application, there's a disability determination representative for Social Security Disability for Disability Determination Services is actually the department. They'll make the decision there. But if you end up having to request a hearing, you go to a hearing, that will actually be a federal judge, an administrative law judge appointed that works for the federal government and is hearing just Social Security disability claims.
How does a person know if they even qualify for disability benefits?
Well, the first thing is, first question I would ask myself is, and it's kind of one of those things, when you know, am I no longer able to work because I'm hurt, or I have a condition that prevents me from being able to work? Another important thing is how old are you? It's much more difficult for a young person to get Social Security disability than for an older person. And the reason for that is typically there are many more jobs that a young person can do than an older person can do. So, if you've lost your job because of your health, might want to call a Social Security disability lawyer.
I think people understand that that's one of the areas of law you practice.
Yeah, and we'll run into that a lot of times in really big injury cases. Person's very severely injured, they can no longer work. Well, one of the first things we want to do is apply for Social Security disability, try to get them what they paid for out of their paycheck all these years. And also, you can get Medicare or Medicaid, depending upon how much you paid into the system, as a health benefit when you're determined to be disabled. So, the disability goes hand in hand. If the lawyer's paying attention to it, the disability goes hand in hand with the personal injury case, because it's a very severe personal injury case. Good possibility the person may not be able to work anymore.
Mark, what if a person can't work, but their spouse is still working? Will they get to keep? Will that keep them from being able to apply for disability benefits?
So the question kind of is, because there are two different programs out there. One's called SSDI and one's called SSI. SSDI is the federal government program that you paid into in your paycheck year after year that you've worked. Okay, so an SSDI is a much more robust or better or bigger benefit than SSI. Okay, so if you've never really worked, or you worked jobs where you got paid cash, or you were self-employed and you didn't pay yourself a salary, you may not qualify for SSDI. You can only apply for SSI. Well, for SSDI, there are no asset limits. You could be a multimillionaire and you could be a billionaire and still get SSDI. SSI, if SSI is the only program you can qualify for, there are asset limitations for SSI, and they're kind of complicated. Another time to talk to a lawyer. But if your spouse works, you're probably going to have too much in assets for yourself to qualify under SSI. But again, if you've worked during your life, you probably will qualify for SSDI, which is a better benefit anyways.
What if a doctor puts you off work for, say, 6 months? Can they get temporary disability benefits through Social Security?
There's not really a temporary
I
disability.
mean, they plan on returning to their job. So
Yes.
can they still get temporary disability?
So there's not a temporary disability benefit under the Social Security disability programs. There is temporary disability, or what's called short-term disability and long-term disability under many employer programs. So, what we usually see is somebody becomes disabled, their employment provided short-term and long-term disability. They'll start collecting those while we're applying for the Social Security disability. But Social Security disability does not have a temporary disability benefit. It does have what's called a return to work benefit, though. So if you're on Social Security, let's say you're on Social Security for 10 years and you think you're doing a little bit better and you'd like to try to go back to work. You go back to work for a period of 6 months. You can tell Social Security disability that you're going to do that, and they'll set you up with what's called a return to work period. And depending upon how you do with that, if you can't complete that, you'll keep your benefit. If you do complete that, you'll lose your benefit, but you're back in the workforce, which is always good.
I know we're talking about different benefits. I wanted to get something in. I was listening to a show. I promise you, I'm not getting political, but I was listening to a show the other night about the train. I guess it was in Pennsylvania or Ohio. It happened about, I know you know about, we talked about, probably happened about 4 or 5, maybe 6 months ago. And they were interviewing, and this is my kind of Mark's specialty. They interview people, and no one has even been down there. They're saying to help them. And I mean, can that be, I mean, with FEMA and everything, can that actually be true?
Doesn't sound true. And I remember news reports from early on in the disaster. FEMA was on site. I remember in the West Texas.
I remember that too.
Yeah, the West Texas explosion case where we had 182 clients. FEMA was there within 2 days, three days at the most. I remember in the Arkema chemical explosion down in Houston, FEMA was on site within 3 days. So FEMA, I don't personally know, but I would be shocked to hear that FEMA had not been there in this period of time. I'm sure they were there immediately.
Mark,
they've already left. It's very possible they've already left.
I got you. How did you take care of 180 clients?
Well, we used to call it a car wash. We used to say, we've got a car wash here, and here's what are all the steps of the car wash that the clients have to run through. And we just try to do it as systematically as possible. But it was a big, difficult case.
I bet you had to hire additional people, huh?
Well, we did. We partnered with other law firms.
Wow, that just sounds mind-boggling. We're sitting here. We're talking to Attorney Mark Underwood. He is a personal injury attorney. He covers, actually, you cover all of Texas, but his office is in McKinney, Texas. If you are in Fort Worth, I'm sure Mark has Zoom there that, if you don't want to drive all the way over there. Do you do many Zoom consultations, Mark?
Well, since COVID, we mostly do Zoom consultations. COVID totally changed everything. Of course, we used to always wear a suit and tie to the office every day, and now we probably just wear a dress shirt and khakis. We used to have to go to court in suit and tie. Now what we do is we have Zoom calls with the judges, and I keep a jacket over here with a tie over there, just to throw on from the waist up during the call. So, and at the same time, if a client has a case we're interested in, and they're in Alaska, we'll talk to them, you know. So doing a Zoom call for somebody in Fort Worth or Dallas is pretty common these days.
By the way, I wanted to tell you something a little bit off the subject. I think your gas, I mean, do you buy regular gas, Mark?
Well, I buy regular unleaded gas.
Okay, so I had heard that gas is around 310, 315 there.
I think that's right.
Is that right? Well, here in Florida, and we're on the ocean with all these big vessels, we're at 360. It's about 360 everywhere. So I know you think you got it bad, but we've got it worse here in Florida. And I just heard that California is over $7. And
Well,
it's regular unleaded gas. I just wanted to say that.
Florida might be the only state in the country that has a cover charge just to get into it.
Well, when I talk to my kids in Dallas, and you're always about 50 cents a gallon less than we are. And I just couldn't figure it out. But anyway, see, when I talk to Mark, sometimes I stray back to my Dallas days, the weather there, how gas is there, big cases like Mark is used to handling. So excuse me from straying off. Mark is with us every month. And I noticed that today, a lot of people asked if we are going to be doing auto accidents, but I had a lot of people ask about disability benefits, and we haven't done a show like that for a long time. So I wanted to get disability benefits on today. But I promise you, if it's okay with Mark, we'll talk about auto accidents, which also is motorcycle, truck, boating. It's not just an automobile. If that's okay with Mark, I promise you we'll do that, though. Well, will that work for you, Mark?
That works for me, yes.
Okay, buddy. So we've been scrolling Mark's phone number below the screen. It's really great if you're watching us. But if you're listening on radio, Mark, give everybody your phone number again.
Hey, phone number is toll-free, 844-UNDERWOOD. That's 844-863-3796. Toll-free, 844-UNDERWOOD is the best way to get a hold of us.
What about your social media? Do you have email?
Well, website is underwoodlawoffice.com, or you can contact me at info@underwoodlawoffice.com.
Beautiful. Like I said, Mark will be back with us again next month. Mark, you always explain everything so well. I mean, if I'm a client, God, you're just God sent as being my attorney. And I hope if anyone's in an injury accident, they will contact you. You know, most of the things that Mark does, you don't have to sit there and write him a check until he does such a great job, and then he deserves everything he gets. Right, Mark?
That's true. The vast majority of the work we do is on a contingency basis. Contingency basis means you don't have to pay us up front, that we'll take a percentage of what we recover for you. And if we're successful, we get paid. If we're not successful, we don't get paid. And, that is really a way that provides access to the courts and access to justice that most of the world doesn't have. When I was a young man, I had the opportunity to spend a semester during law school in England, and the British solicitors were very jealous of our contingency fee system because they didn't, at that time, I don't know what they have now, but at that time, they didn't have a contingency fee process. And it does provide an opportunity for many people to exercise their constitutional right under the 7th Amendment to pursue a civil case.
And I also think that you help level the playing field too, Mark.
Yeah, we do that every day.
I know, buddy. Listen, have a great weekend coming up. We will see you again next month on the Ask the Expert Show. Thank you, Mark.
Yep. Thanks for having me on again, as always.
We love you, bro.
Yep, love you.
That was attorney Mark Underwood. He's such a great attorney. If you have a personal injury problem, give him a call. He's so good. That's it for us today. We will be back with you next Wednesday at 4:00 your time with more Ask the Experts. Be safe. See you soon.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.